I wish in the past administration we had had an Operation Warp Speed for the development of antivirals, because it's very probable that these antivirals will not have limited activity against different variants, and they will give us the ability to have much more durable countermeasures that can confront COVID in terms of its morbidity and mortality. Many people think the COVID pandemic is over, but they stop to realize that we're losing between 400 and 500 people a day are dying from COVID. All of those individuals' deaths could be averted if we had the proper armamentarium of antivirals. So the real great need in this nation, and I've been an advocate of this over the last 2 to 3 years, is that we really need an Operation Warp Speed with enormous redundancy for the development of antivirals.
Yeah, we looked at thousands, 3,000 by the time that Linear Therapies come along, and now probably over 6,000. And still Linear Therapies agents are the best that we've seen in the hamster model for reducing virus, even after one dose.
But as I mentioned before, vaccines have limitations, and they will continue to have limitations. And so it's really important that the other countermeasure that we aggressively pursue is antiviral drug development. One of the things I've had an opportunity to work with Linear Therapies over the last couple of years, and they have developed what I call a platform technology that can be used to very rapidly develop antivirals for therapeutics for new pathogens like COVID and others. I will say this, and for those of you that are in Congress and that are trying to help our nation prepare for the next pandemic, I think it's very important just to tell the truth. We are not prepared for the next pandemic. I think it's also very important, to tell the truth, and what I believe is the next pandemic is coming, and I call it the Great Pandemic. The pandemic that we just went through with COVID and are still, in the process of, I call the lesser pandemic. The Great Pandemic is coming. It's likely to be a bird flu pandemic. It's likely to have mortality rates between 5 and 50%, and it's very likely to bring our nation to its knees. This is why it's so important to get prepared. This is why it's so important to have redundancy and investing in a variety of different platform technologies that can be available to be able to launch a meaningful countermeasure to the next pandemic. I'll kind of close with where I'm in my own thinking, and I've spent more than 45 years in this space as a clinical virologist, over 20 years at Walter Reed in the Army, really focused on the potential of virological threats. And then obviously my time building an Institute of Human Virology in Maryland, and then my time running CDC. I'm of the point of view, and this is not hyperbole, I'm of the point of view that the greatest threat to our nation's national security is biosecurity. I say that I think it's a greater threat than China or Russia or North Korea or Iran.